Marilyn Dubry, Executive Chief Nursing Officer at Vanderbilt University Medical Center, and Cody Hamilton, a registered nurse at Vanderbilt Medical Center's dedicated COVID-19 intensive care unit. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Today is the first COVID-19 press briefing since the beginning of the modified Phase 2 of our roadmap, which is a difficult but necessary decision to protect our residents from a sharp spike in coronavirus cases across Davidson County. We have seen a dangerous new spike in case numbers. On June the 22nd, at the start of Phase 3, our 14-day moving average of new cases was 133. Today, that number is 264, a near doubling in just over 2 weeks. Our entire nation continues to see increases in new COVID-19 cases. Over the first week of July, the United States reported its 3 largest daily case totals, and new daily cases are now rising in 42 states. Unfortunately, Tennessee and Davidson County are part of this alarming trend. As shown in the maps distributed to the media this morning, we started to see a shift on June the 15th. Concentrations include not only southeast Nashville and Madison, but now have spread to other parts of the county, including our downtown core. Contact tracing investigations have identified the following primary sources of spread. Roughly 1/5 of cases originate from household contact. Another 1/5 of cases are coming from non-essential workplaces. 16% come from the so-called community spread, including certain faith-based group activities, small gatherings and parties, and weddings. And 13% of cases come from domestic travel, and around 7% come from essential work sites, including construction, food production, and healthcare. Now, clearly some of the spread is very hard to contain. Household contact, essential workers, nurses, and food supply workers. But we are also becoming vectors for the virus through non-essential activities, including community spread. At the outspread of the coronavirus, many Nashvillians refrained from gatherings with friends and family, even in very small numbers. But behaviors and attitudes may have changed, but the virus has not. To quote Sumner County Mayor Anthony Holt, pandemic fatigue is real. Virus fatigue is what we have to fight. Relaxed behavior has produced a rapid increase in case numbers. And now we are performing record numbers of tests, but also seeing our positivity rate at a 7-day average of 16.2%. Now this rate used to be consistently around 10%. Our modified Phase 2 was created to reverse this trend by temporarily closing or reducing the maximum capacity at venues that have proven to facilitate the spread of the virus or may have the potential to do so. Other places have responded to the challenge similarly. Colorado has closed restaurants, bars, and other large gathering places for 30 days, following the lead of Denver. Florida closed bars statewide after previously allowing them to reopen. Effective tomorrow, Miami is reclosing venues and dine-in service at restaurants. Miami has also implemented a 10 p.m. curfew. New York City entered their Phase 3 yesterday, but modified their plan to keep indoor dining closed. Texas ordered bars to close on June the 29th and restaurants back to 50% capacity. This is exactly what we have done here. California has closed restaurants to dine-in service for at least 3 weeks in 19 counties, including Los Angeles. Michigan closed indoor bars after a spike in cases. Pittsburgh reclosed dine-in restaurants and bars, and Arizona has reclosed bars for at least 4 weeks. Now, in Nashville, we are also following the data and the guidance of our public health experts in implementing our modified Phase 2 guidelines. Our local hospitals have 27% of floor beds and 28% of ICU beds available, which exceeds our target of 20% for both metrics. But our 14-day case average remains in the red, and our transmission rate at a median of 1.23 is now also red. For context, the city of Houston, a city with gigantic health capacity, is already facing a critical bottleneck of healthcare resources caused by new COVID-19 cases. And the city of Houston has an average transmission rate of just 1.2. This is below our transmission rate. Now, the city has warned its residents that at the current rate of infection, hospital staffing, beds, and other resources will be exhausted within just 2 weeks. So without immediate action by every Nashvilleian, we may soon find our local healthcare system having a similar challenge. Now, as of today, Nashville's citywide testing rate continues to increase. We've added 5 more tents at Nissan Stadium to reduce wait times and increase our testing capacity. More than 109,000 residents have received a COVID-19 test across Davidson County as of yesterday afternoon. More testing is a good thing, and as Dr. Hildreth said, it gives visibility to an invisible enemy. And I encourage all Nashvilleians to get tested if you have symptoms or may have been exposed. Metro's community assessment centers are open Monday through Friday from 9 a.m. to 3 p.m., where you can receive a free COVID-19 assessment and diagnostic test. Metro Public Health has distributed 239,000 masks to Davidson County residents so far and will continue to hand out its current supply of 180,000 masks. Face coverings, whether manufactured or homemade, are one of the most important ways of slowing the spread of the coronavirus, and we must use them. But remember, face coverings are not a substitute for safe social distancing, frequent hand washing, and receiving prompt medical attention if you feel symptoms of COVID-19. There has been an increase in cases among all our neighboring counties. Our neighbors in Rutherford County now have more total confirmed cases than Hamilton County, home of the state's 4th largest city, Chattanooga. Every county touching Nashville is currently above the state's threshold for acceptable disease transmission. Others, including Sumner County, have recently been forced to place ambulances on diversion due to a record number of hospitalizations caused by the virus. Here in Middle Tennessee, face coverings are now required in Sumner and Williamson County as of yesterday, and the mayor of Montgomery County also signed a face covering order on Monday that will begin at midnight tonight. And we will continue to work with our regional and state partners on a coordinated response. Now, this morning, I want to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who's joined us once again to share his thoughts on the coronavirus and how we can all best protect ourselves and each other during this challenging time. It is also a pleasure to welcome Marilyn Dupree, Executive Chief Nursing Officer at Vanderbilt University Medical Center, who is with us this morning to discuss the importance of maintaining healthy habits to continue flattening the curve of the coronavirus and protect our local hospital capacity. And finally, I want to welcome Cody Hamilton, a registered nurse at Vanderbilt's dedicated COVID-19 intensive care unit. Cody is one of Nashville's 11,000 registered nurses and 2,000 advanced practice nurses. And I am grateful to all of our frontline healthcare professionals for their hard work and selfless dedication, especially during the current public health emergency. These are the people looking after our loved ones. Don't make their job even harder. Every one of us has a duty to practice healthy habits to slow the spread of the disease and save lives, to patronize only those businesses that are behaving responsibly, and to get tested as necessary or follow quarantine orders as required. And until we each recognize the responsibility we have to one another and to protect our local economy, both will remain in jeopardy. Ultimately, our public health outcomes depend on every single resident of Davidson County. Of course, our policies are guided by public health expertise, but they simply explain what we can or cannot do, what we all should do, what we must do as family members, friends, neighbors, and as members of the community is up to every single one of us. I will now turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 12,338 confirmed cases. That's up 1,596 since Thursday. There are currently 4,012 active cases in Nashville, and 67% of all confirmed cases, or more than 8,200 residents, have recovered from this virus. Since our update last week, 11 Nashvillians have died because of COVID-19. 119 Nashvillians have now died because of this virus, a mortality rate of 1% for our city. As always, my sympathies do go out to these individuals' friends and loved ones. Our 14-day rolling average of new daily cases continues to increase. This morning, that average is 264. This metric continues to be red in our dashboard. The transmission rate for Davidson County is 1.2, and this puts us also in the red category for our dashboard. The other four metrics remain green. Testing in our city continues to be at an adequate pace. Since last Tuesday, more than 14,000 people have been tested. Our contact tracing resources, which have monitored the spread of this virus, continue to be enhanced with these new cases. And 27% of hospital beds and 28% of ICU beds are currently available in our region. 167 people are currently admitted to Nashville hospitals with COVID-19. Now, we will be looking at hospital numbers very closely over the next few weeks. Hospitalization numbers typically lag case numbers. So with the record number of new cases over the past week, we may see these numbers change in our hospitalization rates. The good news is that our hospital systems are keeping up. Hospitals have surge capacity plans in case we start seeing the increased cases. And so far, we have not had to use this surge capacity. In addition, there are additional 70 beds at Nashville General Hospital as part of the state's alternative care site. We are also working with the state for additional regional resources if needed. Now, we saw a spike in cases after Memorial Day weekend, so we very well may see a spike after this past holiday. If you're out celebrating in a large group of friends and people, if you let your guard down, you may have come in contact with someone that has the virus. If you are concerned, please get tested. Our assessment hotline is open today and every day from 7 a.m. to 7 p.m. And our 3 community assessment centers are open until 3 p.m. today, and they are open every Monday through Friday from 9 a.m. to 3 p.m. Just yesterday, 2,147 individuals were tested in our 3 assessment sites. Now finally, even though today's new case number is 149 and lower than the past several days, we cannot let our guard down. The virus has made a strong resurgence, and we need to recommit to do the things we did back in the spring to help flatten the curve. Stay at home unless it's absolutely necessary to go out. If you do go out, keep your distance and wear a mask. Now, wearing a mask is one of the most simple but effective things you can do to help fight this virus. Now, I am very happy to see some of our area county mayors have issued mandatory mask orders. But we are not alone in this. We must fight this virus as a region. So I call upon all county mayors in our region to please follow suit. Your leadership right now is needed more than ever. The life and well-being of your community and ours is on the line. I now introduce Dr. Hildreth. Thank you.
Good morning, Nashville. Over the last several weeks, I've shared with you observations regarding COVID-19 transmission events that show how efficiently the virus is transmitted from one person to another. The most recent was the family in Texas, a family of 30 that got together to celebrate a birthday, and as a result, 17 members of the family contracted the virus from a single person attending the event. Stories like this abound in published research and in public health records from around the world, including a very well-documented case in a Chinese restaurant. In this particular case, a single individual caused infections of persons sitting at their table, but also infections of people sitting across the room, certainly more than 6 feet away. And consider all the reports that we've seen and heard of transmission events happening at weddings, choir rehearsals, nursing homes, cruise ships, bars, and in other settings where large numbers of people are together. All of these cases point to an inescapable conclusion that breathing the exhaled air from an infected person in a closed environment for more than a few minutes results in infection by the virus. And now in an open letter published very recently in the scientific journal Clinical Infectious Diseases, more than 230 scientists and infectious disease experts from around the world have stated that it has now been proven beyond any reasonable doubt that COVID-19 virus is an airborne virus and can be transmitted as such, that it remains in the air for long periods of time, and that this is a major mode of transmission. The scientists note in their letter that COVID-19 has been demonstrated to be exhaled during normal talking, and that it becomes associated with what we call microdroplets, as small as 5 microns, which is less than 1/10 of the diameter of a human hair. Furthermore, we know from other published work that a droplet of 5 microns can travel as far as 40 feet in the air before it falls to the ground. They explain that in some major mitigation practices currently being promoted will have no effect on this mode of transmission, including washing of hands, social distancing, and sanitizing high-touch surfaces. This group of 239 scientists have appealed to the WHO and global national leaders that this be recognized as a major mode of transmission and that we take steps to mitigate it. They make 3 very specific recommendations. Those recommendations are, number 1, provide sufficient and effective ventilation by supplying clean outdoor air, minimizing recirculating air. This should be done particularly in public buildings, workplace environments, schools, hospitals, and nursing homes. Number 2, supply general ventilation with airborne infection controls, such as local exhaust, UV lights, and highly efficient filtration. The third and final recommendation is something we've heard before, to avoid overcrowding, particularly in public spaces and on public transportation. There's one direct quote from this remarkable letter I think I should share with you, and I quote, "We are concerned that the lack of recognition of the risk of airborne transmission of COVID-19 and the lack of clear recommendations on control measures against airborne virus will have significant consequences. People may think they are fully protected by adhering to current recommendations, but in fact, additional airborne interventions are needed to reduce risk." This letter from some of the world's leading experts is quite timely as cities and states reopen their economies, bringing employees, patients, school children, and university students back into environments that do not necessarily adequately prepare for airborne transmission of COVID-19. It's especially germane here in Nashville as we witness large gatherings of people in closed and confined spaces who do not wear masks and are just ignoring the virus risk altogether. This letter is a call to action regarding airborne transmission of COVID-19, and we should all think about prevention measures that mitigate against this mode of transmission. It is very disheartening, discouraging, and disappointing to witness what is happening around the country right now. As you've heard from the mayor, 42 states are now reporting higher numbers, and we can predict with almost certainty that there's going to be a surge of hospitalizations and further deaths of folks because of this. And I say once again to those who say there will be a second wave, no, we've not dealt with the first wave, which means that come the fall, we might not be ready for students to be back in universities or kids back in school. We got to get this under control. We all need to do our part. And as Dr. Jahanger said, one of the simplest, most effective things that we can do is to wear one of these when we go out. And with that, I'd like to introduce Marilyn Dubree, Executive Chief Nursing Officer from Vanderbilt Medical Center.
Thank you, Dr. Hildreth. Throughout the past few months, healthcare providers like Vanderbilt and other providers across our community have focused on safety, the safety of our patients, our staff, and our colleagues in our community. That focus has never changed. We continue every day, every night, every week, and every month now to focus on the safety of patients. But we also are focusing on the safety and well-being of our workforce. Healthcare workers have been recognized for their skill, their dedication, their compassion. This acknowledgement, the moniker of essential workers for healthcare workers and many others, has been greatly appreciated by our healthcare teams. But nurses and their team members have learned, along with others, much about the coronavirus as facts and information, as Dr. Hildreth have shared with us, become known. And we have reemphasized our focus on hand washing, on distancing, and on masking. These age-old practices for patients, for protecting patients and for ourselves, have never been more important than they are now. Our ability to do these allows us to care for our patients and for you every day, wherever and whenever you need us to do so. For us, these practices of protection are just as important in the community as they are in the healthcare setting. Our discipline and precision at doing them has never been more important. In my role, I have the privilege every day of working in an amazing place with extraordinary people taking care of individuals seeking health and hoping for relief from illness. That has never been more true than it has been in the past several months. It's now my pleasure, and I have gratitude to Mayor Cooper, for offering us the opportunity to share a bit of information from one of the nurses at Vanderbilt, Cody Hamilton, who has been working with these patients, to tell you a bit of what it's like to care for them.
Thank you, Marilyn. Ultimately, first off, I'd like to say thank you for the opportunity to share about what it's like kind of in a COVID intensive care unit. And I really wish there could be an opportunity for the average person to kind of do a drive-by or be a fly on the wall in the unit, because I think you would reconsider wearing a mask as something as difficult, because these patients are without a doubt the sickest patients any of us who've worked there have ever seen. As an ICU nurse, it's a physically, mentally, and emotionally demanding job. But with COVID-19 patients and the intensive care is really testing what is withstandable on the nursing end in these categories. These patients, they don't recover quickly. They stay very, very sick for a long time. And even once they battle and win against the virus, the residual effects often require longer periods of time in intensive care units to recover and rehab them from the damage done. Also, we have learned through research of how vital family is in intensive care units and helping these patients recover. And these COVID-19 patients, they don't get to have family there with them. We're the only interactions they get with people. And oftentimes, we are protecting ourselves, so the lack of touch, the lack of a familiar face or familiar voice are all absent. Also, this virus has zero bias. Young people, old people, middle-aged, it's affected them all, and it's continuing to do so. So ultimately, I just encourage people to stay safe, because, like I said, if you could really just be a fly on the wall in that unit, I think it would change people's minds.
Thank you, Cody. We'll now begin taking media questions, starting with Nancy Amons at WSMV. Nancy.
Hi, thank you. Can you speak about efforts to enforce the mask ordinance, especially downtown? I think we're seeing a lot of folks not wearing masks. And also, can you elaborate a little bit on the 16.2 positivity rate and why that's important? Thank you.
Sure. We'll start with Dr. Wright regarding your questions on mask ordinance. Oh, sorry, Hugh Atkins.
Yes, on the individual face masks, we are working with Metro Nashville Police Department. They began handing out information to their officers during their morning roll call, and they have information that they are providing to individuals that they see that are in violation of that order. And they will continue to do that, but if they reach the point that they're ready to start issuing face masks, then, that would be a good thing too, maybe give face masks out. But also they will, Metro Nashville Police Department will be issuing those citations for individuals that are in violation of the order for mandatory masks. Thank you.
And Nancy, thank you for bringing up the point that our test positivity rate is getting higher. So if you remember, a test positivity rate is how many people who are being tested turn up positive. Well, we have been testing thousands of people a day, and as I mentioned, 14,000 last week. Our test positivity for many weeks had been around or below 10% as a total of all tests, of all the 109,000 tests conducted. That number out of the 109,000 has gone up to 11.3%. Of the tests conducted yesterday, 16% were positive. Now that gives me, Dr. Hildreth, and other experts a lot of alarm, because it means that you would hope that as we're testing more people in our community, the percent that are positive is going downward. But because it's going up, it means that this virus is very rampant in our community, and it causes a lot of problems. And I think I want to build on something that Mr. Hamilton had said. It's really resonating with me, is this virus impacts everyone, right? You're young, you're old. We reported a 30-year-old person passing away this weekend, or just yesterday. And I'm learning more about it, and my gosh, that's scary, right? But I also, what's equally as scary to me is that the people in Nashville who are 65 years or older who get the virus. So if you're 65 years and older and you get the virus, 10% of those individuals in Nashville alone have died. I mean, that is staggering to me. So there's about 850 people who've gotten it who are 65 and older, 85 of them have died. So this virus is deadly, irrespective of age, but it can kill anyone, but it really, if you're over 65, it really impacts you. So high test positivity demonstrates to me that this virus is very rampant still. So thank you, Nancy.
Stacey Case at Fox 17.
Thank you all. Some bars and restaurants downtown say that government is operating outside of its constitutional authority. They would like government to use even more disease control methods like quarantining and more contact tracing instead of, as they say, arbitrarily targeting bars and restaurants. And they point out large gatherings of protesters have not been subject to the same mandate. They call this selective enforcement. What do you say?
Thank you, Stacey. Mayor Cooper.
Thank you, Stacey. I read a pretty long list. It could be a longer list of states and cities following the same protocol. This is not only not selective, it's virtually national in its scope, in the response to slowing the spread and to stop these kind of super spreader event locales from being a problem also in Nashville. We are unfortunately not alone in dealing with this difficult acceleration of cases. And what did we learn from our earlier experience? Back earlier at lower capacities and smaller gathering sizes, the rate of spread did slow down. We've already know from our own experience how to slow down the disease. Using that tool today is appropriate, and look at the long list of other cities and states that have come to the exact same conclusion.
Jeremy Finley at WSMV. You're on the air.
Good morning. Thanks for taking our calls. Wanted to ask, with so many families, I had a couple questions. With so many families considering going on vacation, this is really for Dr. Hildreth, I think. Would you recommend that families not travel right now, especially if they're going to the beach? Or would you consider that to be the safest location for families to go to? I know a lot of families are struggling with that question, if they can even afford to take a trip. Would you recommend that they not go? Second, this is for the Metro Health Department. We are hearing a lot of complaints from residents, from families of residents inside the Trevecca nursing home. And we wanted to inquire as to how Metro feels right now, specifically about that nursing home and what steps they are taking to curtail the virus. In one of those cases, we have a woman that has tested positive twice for COVID-19, and I wanted to inquire to see if the Metro Health Department is seeing many cases of nursing home residents testing positive twice in the city, and what your concerns may be about that. Thank you.
Thank you, Jeremy. Dr. Hildreth.
Jeremy, I think it's perfectly fine for families to take vacations, especially if they're going to drive to somewhere. And if the family's been in their bubble together, as long as they travel in a virtual bubble together, take the steps necessary to protect themselves, I don't think there's anything wrong with traveling. But we must be mindful that the virus is everywhere. And the same things we do to protect ourselves when we've been in our homes and in our normal settings, that needs to be transferred to wherever we go. Me personally, I'm not getting on an airplane anytime soon, for example, but we can take a driving trip, do something outdoors, that's perfectly fine. So I don't think there's any problem with having a vacation, but please be mindful of the virus and do the steps necessary to protect yourselves while you're on vacation.
The Trevecca Nursing Home is one of many in Nashville, Davidson County, and the Department of Health is working very closely with the state of Tennessee Department of Health, their health care bureau for overseeing nursing homes. We are assisting all of the assisted living and nursing homes to do testing. And you can find on the Tennessee Department of Health website the list of all the nursing homes with active cases, and that is updated regularly. As for Trevecca specifically, it has been one that we have worked with closely. And I have even spoken to the president and CEO of the organization that runs Trevecca a number of times. So we have a direct communication with their management, and we will continue to work closely with them. This virus presents a challenge in the community, especially for those who go out and in, such as the employees. That is why the governor, as well as the federal government, have not only recommended but required that employees get tested weekly. And we're going to assure that this happens. And we're going to assure that if there are cases of COVID in the nursing homes, that they take all of the required precautions to assure that those patients remain safe and isolated.
Ian Jung at the Tennessean. Ian?
Good morning. Can you explain the rationale of allowing transportation to continue at half capacity while bars are closed under the modified plan? And then curious if there's been any discussion about placing a limit on travel into the city from out of state. And Dr. Jahangir had mentioned a surge plan for hospitals. I was curious about at what point does that get triggered and what would that look like? Thank you.
Okay. Your first question about transportation, Dr. Caldwell?
Transportation does present a challenge, but there are, the element of it being outdoors is very positive regarding it not being indoors, because we know that most of the transmission has been indoors. The capacity of these vehicles have to be at 50%, but even though they might be only at 50%, it oftentimes looks as though they are more full than they are, because a number of these people who are on these vehicles seem to want to go towards the edges. I've noticed that a number of them are not properly social distancing, they're not wearing face masks, and it is a concern that I have. And we are going to continue to work on trying to find ways to get them to be more compliant.
Regarding your question about limiting people traveling into the city, short answer is no, there's not been any discussions about that. Nashville is an amazing city in which a lot of people in our region come to daily to work, to get health care, to get education. This is why the idea of having our regional counties and their mayors help us in a regional response is so critical. Nashville's open to these critical things, and we just need to make sure that we're all responsible when we do come to Nashville. Because when you come to Nashville, If you get a case here and you go back to your home county, you're taken to your home county. So please remember that. Regarding your question about hospital capacity, there is a plan that is led by the state that we communicate. I communicate almost daily with the deputy commissioner who's in charge of it. Every week, the hospital CEOs and I with Dr. McDonald, we speak about this pretty regularly. It's very transparent where the triggers are as to when they would consider opening the alternative care sites. We look at hospitalization numbers every day. We report every day to you all how much bed capacity there is in our city and our region. So we look at it every day. And if we needed to ramp things up, there's triggers of how many people are admitted to hospitals would then trigger staffing. As I remember, the alternative care side, Nashville General, is all good to go short of staff. And there's a staffing plan that could be elevated within, I think, 5 days or so. I would defer you to the state for that exact number. And then in addition to the alternative care side, Nashville General, there's plans for an additional location if needed. And that's on top of hospitals already stepping up and increasing their own personal surge capacity. So as of this moment, hospital capacity is okay, but your question is a very important one. There is a plan. I just hope we don't ever have to trigger it because we're going to all be responsible and help keep the curve flattened, something that we hadn't talked much about since March. So help us flatten the curve, please. Thank you.
Brooke Reese, WKRN. Brooke.
Hi, thank you for taking our question. When we're doing social tracing for people being diagnosed with COVID, are they being asked if they've attended a protest?
Thanks for that question, Brooke. Dr. Caldwell.
Yes, that question of whether you had attended a recent protest rally has been added to our contact tracing questioning.
Blake Farmer, WPLN. Blake?
Hi. This issue of a new hotspot in the urban core, I assume these are people who live downtown. What does it tell you that there's so many new cases right in the center of the city? I assume meaning people who live in downtown condos. Can we get some more color on that?
Sure. Dr. Caldwell?
That's an excellent point, and it's a good reminder that the way we present this data and the hotspots are specifically where people reside, not necessarily where they contracted the virus. However, from experience, we know that most people do contract the virus close to where they reside. So it is a good indicator that wherever you're living, you're frequenting that area around where you live, and you probably contracted it in that area. So whether these individuals are specifically tied to a cluster in one of these indoor bars recently, or just being around living in close quarters and maybe not following the requirements of wearing the face mask and being socially distant, we know that virus is very active in that area, and we would ask people, especially in that area, to take the strongest and most stringent precautions because they are all at risk.
Brett Kelman at the Tennessean. Brett.
Hi, good morning, everyone. So the mayor opened with a comparison to Houston, a very healthcare prominent city that has struggled to maintain enough healthcare resources to treat the outbreak in that city. I'm curious if anyone can put an estimate on this. If the outbreak in Nashville were to continue to grow at the transmission rate it is on now, how many weeks do we have before, like Houston, we are running short on hospital capacity? If things continue as they are, when does that happen?
All right. Thanks, Brett. Dr. Jahangir.
Thank you, Brett. That's such a critical question that I think about regularly. I talk to hospital CEOs about it. I know Vanderbilt Department of Health Policy is releasing, I believe, a study tomorrow answering that exact question. So I'm going to defer to them to give you that. I don't want to steal their thunder, but I will tell you that if our transmission rate continues to be where it is and we continue to increase infections, our hospital numbers today was 167. I think it was in the 120s, 130s last week. So we are increasing numbers. I think I would say at this rate, the other thing I worry about is right now, one thing to add to Dr. Caldwell's question about we're seeing the increase in the urban core. These are younger people. These are people of non-Hispanic ethnicity, which is something I think previously we had seen. I bring that up in regards to this question because these young people, more likely than not, are not going to get sick. Just statistics will tell you that. 2 weeks from now, those people can infect their parents or their grandparents. Those are the individuals that will get sick and will take up more hospital capacity. So I do worry at the current rate. I mean, 4 weeks, 6 weeks, I don't know the exact number, but I do know that that's where my mind is. I know some stuff at the Vanderbilt study that would probably show something to that equivalent, but I would defer to Dr. Graves and his group to give you the exact answer there. But I think it's not unreasonable to think within the next several weeks one could potentially have a problem, and for the reasons I mentioned. So thank you.
Those are all the questions that we have in the WebEx queue this morning. I'd like to thank Dr. James Hildreth, Marilyn Dubree, and Cody Hamilton for joining us today. The next scheduled Metro COVID-19 press briefing will air on Thursday, July 9th at 9:30 a.m. Thank you for joining us. This concludes today's event.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.